Assalamu alaikum. In this video, we will understand about the cirrhosis. So, what is the cirrhosis? Basically, it is a liver disease. So, cirrhosis is a severe scarring or fibrosis of the liver. It happen in the late stage of non-alcoholic fatty liver and other liver damage condition. So, in this video, the whole story we will understand the cirrhosis. So, please watch the whole video to understand. So the stage of the fatty liver or going to the progression of the cirrhosis, overview we will understand here. So here is the health, basically a healthy liver, hepatocytes, no any scarring, which that show the diagram which that is healthy, but non-alcoholic fatty liver cause the some scarring and it is reversible. Remember, it can reverse. So remember, but the fibrosis, which is the scarring tissue more irreversible, so it will more scarring tissue will lead to irreversible, it will not become a healthy again. So that is known as the fibrosis, and the cirrhosis is the progression of the fibrosis lead to scarring tissue, whole liver will be scarred. So the last option is require the transplantation of the liver. So here is the gastrointestinal tract which that absorb the nutrient, and this nutrient will move first into the liver through a hepatic portal vein, then it will be detoxify and processing, so will lead to circulate the whole body. So anyhow, the stage of cirrhosis, the compensated asymptomatic will lead to cause scarring and fibrosis, but the decompensated symptomatic is jaundice and the acids. Jaundice means the yellowish color due to the bilirubin accumulation in your body. Due to the not excretion the bilirubin into the bile, into the gallbladder. So anyhow, the hepatic hypertension is occur due to the function of hepatic portal vein. So the purify the blood, break toxins, produce clotting proteins. When portal vein will basically transmit the blood into the liver after the absorption of fat and fat soluble vitamins. So it will be possible, remember, in this way the gastrointestinal tract absorb the nutrient and the nutrient will flow toward the liver through hepatic portal vein. So remember, the complication will occur due to the liver cirrhosis is infection, bacterial bleeding, and the sensitive to medication and the malnutrition, kidney failure, and liver cancer and splenomegaly. This will occur due to the liver cirrhosis, but the liver cirrhosis is very dangerous and it is irreversible as compared to the other. For example, the fibrosis can be reversible and fatty liver, non-alcoholic and alcoholic fatty liver can be reversible. Anyhow, the causes of the cirrhosis we will discuss shortly in this video. So here is the hepatitis D, autoimmune hepatitis, and the hemochromatosis, which that will lead to cause the liver cirrhosis and damage to the bile ducts or the Wilson disease. So we will discuss in the next video about the Wilson disease. So anyhow, in this way, the other causes we will understand here. For example, the alcoholism and a non-alcoholic fatty liver disease will lead to progress into the cirrhosis. Remember, a drug and bad lifestyle and medication like antidepressant and antibiotics, which that will lead to damage the liver, and in this way the cirrhosis progression will occur. The viral infection like hepatitis C and the more while the hepatitis B is not, it is rare basically, and on the other hand the illegal injected drugs and sex without condom, kidney dialysis, and the contaminated water, which that will lead to cause cirrhosis. On the other hand, the non-alcoholic cirrhosis can be occur. The alcohol consumption of overdose alcohol will lead to cause fatty liver, fibrosis, and then cirrhosis. I hope it makes sense about that. So non-alcoholic fatty liver disease basically also progress into the cirrhosis. In this way, we will understand the pathophysiological aspect and the mechanism of the cirrhosis progression. So first of all, you should understand here the sign and symptom. So then we will understand the pathophysiology. Sign and symptom can be a decreased appetite and unintentional weight loss, mild pain on the upper right side of abdomen, nausea, vomiting, and enlarged or swollen veins due to this. So remember, and serious symptoms can be yellow discoloration of your skin and eyes. So eyes will appear the yellowish color due to the jaundice, and in this way the confusion, memory loss, and bleeding easily can be possible due to the clotting protein will not synthesis in the liver. On the other hand, the abdominal swelling and swelling legs due to the edema and due to the fluid circulation improperly due to the liver cirrhosis. So that is why liver is very important, which that is maintain the body fluid, and on the other hand maintain a lot more things like the bilirubin, manage and clotting blood protein. So a lot more. This is the internal organ of the body. Basically, is the large organ, glandular, and basically it is glandular and also organ perform the function. So here is the we will understand here is the liver inside, which that contain a sinusoid. The sinusoidal lumen here are present and surrounding the lumen, and here is the blood vessel like structure. So remember, and the surrounding the hepatocyte, and in this way the space of discs are present between the sinusoidal lumen, between the sinusoids and the hepatocyte. Space of disc contain a many cell like the hepatic stellate cell, which that absorb the fat and store the fat. But important thing is that the Kupffer cell are present in the sinusoid, and which that is important for the immune regulation. The environmental stress like the UV radiation and medication as well as the nuclear reactors will lead to damage the DNA, and in this way the cirrhosis can be possible due to the damage of the hepatocyte due to the dendritic cell, and the CD8 T lymphocyte will kill this, lead to apoptosis also. So the apoptosis will lead to produce the death, the damage associated molecular pattern and the antigen mediated protein peptides and debris, the cell debris after the apoptosis. It can be possible due to the HPV, HCV, autoimmunity, ROS, oxidative stress, and toxin basically will lead to trigger this apoptosis, and in this way this debris and dams, amps and debris will produce the cytokines and inflammatory mediators, which that will lead to recruit the Kupffer cells, and on the other hand the CCL1 also produced through a Kupffer cell, and the invasion of the Kupffer cell due to the endothelial dysfunction, while the natural killer cell also recruit for the killing and to cause cirrhosis and the plaque formation. And in this way, on the other hand, the chemokines and cytokines recruit the dendritic cell, so the CCL1 receptor will recognize this inflammation, lead to produce the cytokines, chemokines, transforming growth factor beta, tumor necrosis factor alpha, and the reactive oxygen species, as well as interleukin 1 beta and endothelic growth factor and vascular endothelic growth factor, as well as the necrotic factor kappa B and CCL1 and 2, which that is the inflammatory mediators, lead to activate the hepatic stellate cell. This hepatic stellate at quiescent stage will lead to activation to active the hepatic stellate cell. This active hepatic stellate cell will activate the other a fibroblast. So whenever it will activate the fibroblast, so the fibrosis and cirrhosis will occur due to the collagen production more from the fibroblast, and the collagen will accumulate in the site of the hepatocyte, where the hepatocyte will be killed Hepatocyte will be apoptosed due to the opsonization and the immune response, and in this way the activated myofibroblast will lead to produce a collagen, and the collagen will fill in the outer space of the sinusoid, like the space of disc, and in this way also the dendritic cell will activate more the activated myofibroblast to produce more collagen accumulation, and in this the collagen will accumulate more, will lead to cirrhosis. Remember about that thing, the apoptosis will occur due to the HBV, HCV, autoimmunity, reactive oxygen species, oxidative stress, and toxin. On the other hand, whatever. So the diagnosis here, let's understand about that. The skin, eyes yellowish more. In this way, the redness palm, and it can be diagnosed through a CT scan, liver biopsy, and the hands tremor can also possible. A blood test we can understand. On the other hand, the enlarged liver and the enlarged spleen, which that is the functional property of the cirrhosis. Anyhow, endoscopy also used, and the liver function test also used for understanding. So I hope it makes sense about that. Liver cirrhosis is the inflammatory response and the progressive disease after the fibrosis, after the fatty liver, and in this way it will lead to kill the hepatocyte, and in this way the liver will be non-functional and deposition of the scarring tissue and collagen accumulation, and this collagen accumulation will lead to damage the liver and inhibit the function of the liver. I hope you make sense about that. If you like my video, please make sure to subscribe.